How can anyone function if they're being woken up 24 times at night? What about the cumulative effects of this happening for a lifetime? My name is Dr. Catherine Zackel. I graduated from the Faculty of Dentistry at the University of Toronto in 2001. I developed a special interest in sleep apnea after witnessing what extensive damage untreated sleep apnea could do to teeth and dental work. How does sleep apnea damage dental work, you ask? The answer is somewhere in these videos. I have personal experience trying to navigate a system that I felt was not equipped to educate me or help me to even obtain a diagnosis until I did my own education and research. I must admit, I only learned more about obstructive sleep apnea, or OSA, when I completed the American Academy of Dental Sleep Medicine Mastery Program. I became a qualified dentist for oral appliance therapy for sleep apnea. To spare you from having to sift through 300 hours of educational material, I have curated this 60-minute video library for you. I wanted to standardize this information in this manner to ensure that everyone was getting the same level of detail and explanations. This library is only meant to give a broad overview, as the information is just too extensive and new research is being brought forward every day. It is also not meant to give a diagnosis, as dentists cannot diagnose sleep apnea. A qualified dentist can do a screening and a referral to a family doctor for follow-up. The information presented is to raise awareness in general and also offer information about oral appliance therapy. It is my first goal to do away with the old stereotypical presentation that has become the only people identified as having obstructive sleep apnea, which are the older men that are overweight. A study was done in Sweden where they took 10,000 random women aged 20 to 70. Out of those 10,000, they randomly took 400 women and gave them a sleep study. 50% of those women ended up having sleep apnea to some degree. So I would think a broad conclusion can be made that based on the study, that a large section of the population likely has some degree of sleep apnea, maybe even as much as 50%. It is also a disease of progression as we age and our bodies change, so it is important to monitor it over time. So many younger people, thin people, women and children are being overlooked as a result of lack of awareness in general. The outcome is that many people are suffering with daytime sleepiness and other health conditions unnecessarily. I will explain this in detail in the video titled The Many Effects of Obstructive Sleep Apnea. The second goal of this video series is to give a basic overview of sleep and the sleep-disturbed breathing spectrum. Sleep apnea is a complex disease, and knowing more about it will hopefully help improve treatment outcomes and decrease frustrations. Being a complex disease, it means that the treatment results may vary depending on factors that will be discussed in the video called Will Oral Appliance Therapy Work for Me? Another goal would be to allow for self-assessment that will happen along the way with these videos, and especially the video where you can complete the section where you analyze your nose, throat, and jaw anatomy with the worksheet provided. And don't worry if you are not sure of your answers, just put the best answer possible and we will review the answers together. The worksheet can also be sent to our office, and a phone consultation can occur based on the findings before even booking the in-office visit. The success of the therapy you choose, I think, depends a lot on knowledge of the personal condition and also the variety of treatments available. Keeping a sleep log will also raise awareness of what things affect your sleep besides breathing. Such things as even when you have children sleeping in the bed with you, or have pets, or have other health conditions, it's good to keep track of what exactly is keeping you up at night, as well as other effects such as blood pressure and how you feel rested in the morning, or if you don't feel rested. It is my intention to give you the information so that you can make an informed decision on whether proceeding with oral appliance therapy is right for you. I realize that it is extremely important to have some basic knowledge of sleep anatomy, the various surprising effects of sleep-disturbed breathing, and that snoring and mouth breathing are not innocent conditions. I list some references at the end of the worksheet handout, and especially enlightening was the book by Dr. Matthew Walker called Why We Sleep. In the book, he explains how poor sleep can even interfere with weight loss because of how it alters the hormones leptin and ghrelin, which are responsible for appetite and satiety. In other words, some people have obstructive sleep apnea due to increased weight gain. However, if they're not sleeping well and they're expected to lose weight to help themselves, it's actually the sleep that will help them potentially lose the weight so that they can actually manage their sleep apnea better. Of course, I also review how oral appliance therapy and CPAP work. Through patient education, I hope to improve the successful outcomes and minimize any frustrations. So what exactly is involved with sleep appliance therapy? Sleep apnea is an extremely underdiagnosed condition. Oftentimes, the first sign that there is a sleep breathing problem is after a heart attack or stroke. However, it has become apparent that qualified dentists can play an important role in early diagnosis. Again, dentists are not able to diagnose sleep apnea, but we help potentially get the patients to their family doctor so that then they can receive an early diagnosis. We can identify anatomical and dental signs that increase risk of sleep apnea, and we follow that up with screening questionnaire. Patients are then followed up by their family doctors to investigate their general health, and maybe a sleep study is ordered if it's indicated to provide a diagnosis. Once a diagnosis is made, I come back into the picture to fill the prescription for oral appliance therapy. In other words, I act as a pharmacy, taking care of the delivery of a custom oral appliance to treat mild to moderate sleep apnea. Oral appliance therapy is a therapy that takes a bit more time to find the right therapeutic dose or position of the lower jaw in this case. It takes a while to feel the effects that the oral appliance may have, and sometimes the lower jaw needs to be brought forward a little bit more to have improved effects. The oral appliance design allows for changes in the position of the jaw. I stay in communication with your doctor to give feedback and updates on the therapy, and after approximately 2 to 3 months, once we are happy with the results and the position of the jaw, I will send you back to your family doctor for consideration of a follow-up sleep study with the oral appliance in place. The same thing is done with CPAP therapy. They usually want to see one study at least with either the CPAP therapy or the oral appliance therapy in place to see how it's working, if it's effective. Another objective is to allow people to obtain a diagnosis early on for the reason that they may have more treatment options available to them besides just CPAP. CPAP is meant for severe sleep apnea, and oral appliance therapy can be introduced if there is mild to moderate sleep apnea, but the only way to find mild and moderate sleep apnea is to find a diagnosis early on. If you're watching this video, you may already have a diagnosis, but feel free to share these videos with friends and loved ones who may be struggling with their health and sleep. Finally, treating sleep-disturbed breathing early on will potentially change your life dramatically. And I think you will want to reap those benefits early on to be able to enjoy life or an improved quality of life for a longer period of time while not having to wait years for a diagnosis, or even worse, after a major medical event such as a stroke or heart attack. It only took me 9 months into my studies to realize that I had a sleep problem. Being woken up 24 times per night, that was me. You can hear about my story in the next video.